The study is primarily carried out among adolescents in Nigeria. So I'm starting with introduction. So it's unfortunate that unwanted pregnancies and unsafe terminations of pregnancy still occur in large numbers in the adolescent age group in Nigeria. Due to the social, health, and economic relevance attached to pregnancy in this age group, there is a need for reproductive health education in schools and colleges, as well as robust research to determine the contraceptive needs of adolescents and how these needs can be met. As we all know, that the adolescent age group is characterized with a lot of hormonal surge. They are very sexually active, so a lot of attention needs to be paid to this age group if we want to clamp down on the side effect and the complications we get from having unwanted pregnancies in this age group. Even for the wanted pregnancies, there are so many complications accompanying pregnancy in this age group. So whether wanted or unwanted, I don't think anyone would really want an adolescent to get pregnant, whether within or outside the context of marriage. According to the World Health Organization, there are approximately 20 million of unsafe abortions every year, and estimates of maternal death as a result of abortion ranged between 60,000 to 100,000 per year. With the above statistics, investing into family planning, no matter the age group, is worth doing, because the statistic I gave above in the first point is not just about the adolescents. It is just about unsafe abortions cutting across all age groups. So investing into family planning to prevent unwanted pregnancies, which lead people to having unsafe abortions, is worth doing. Well, as I said earlier, there is marked increase in sexual activity in the adolescent population, which is well understood because of the increased sexual hormones, the growth spurts. They want to try new things. Adolescents are adventurous. They listen to friends, watch a lot of things on the TV, so they want to try it out. They read books, all sorts. So, because of the statistics I gave earlier, there is a need to access information about sexual and reproductive health and contraceptive choices among the adolescent age group. And it is not just about accessing information from just anybody. The information has to be gotten from the right source, because an adolescent getting information from an uninformed adolescent, just like himself or herself, will definitely be led the wrong way. Contraceptives use among adolescents is low. The reason for this is because, just like I said, they get information from the wrong set of people. Adolescents are ashamed. They don't want to come out to know that people, to tell people that they're actually sexually active, because of the stigma attached to it, especially in the developing world. So they don't really use contraceptives, and even parents don't really want to share contraceptives with their adolescents. And the reason for this is, talking about contraceptives with the adolescents will definitely involve talking about sexual activity, which a lot of parents shy away from, a lot of people in authority shy away from. Well, we are lucky that these days, at least in this generation now, there is some sex education that has been inculcated into the school curriculum. So some children at least get to hear the right information from the right people. But generally, on the average, the contraceptive use among adolescents is still low. There's a lot of misconception, a lot of fear of side effects, preventing parents from discussing contraception with adolescents. Then another important fact is there's a lack of adolescent-friendly outlets to obtain contraceptives from these adolescents. They don't really have anywhere to turn to. They go to a general place which is meant for everybody, especially, well, the average belief is contraceptive is meant for those who are married. It is meant for those who have at least attained a particular age, at least in the developing countries. So they go to an average health center which caters to the need of everyone. An adolescent enters and he cannot even talk about contraceptive because he's shy. There's a stigma attached to it. The adolescent might actually leave the place, and the next thing that you hear is probably the health caregiver at the primary health center has called the adolescent's parents or someone who knows the adolescent, telling them that, do you know your adolescent came around asking for this? I think you need to So we need to put an end to this if we really want to see an improvement in the use of contraceptives by adolescents. So we need teenage fertility, sorry. So high rates of adolescent fertility have been a particular concern in many countries. Reducing these levels in developing countries is one of the United Nations Millennium Development Goals. But even in some developed countries, high rates still persist, particularly in the United States, where the teen birth rate is much more higher than the rate in majority of developed countries like the US. Teenage fertility establishes the pace and level of fertility over a woman's entire reproductive life. It is believed that anyone who starts reproducing early, who starts getting pregnant early, is likely to have more children in his or her lifetime compared to one who delays reproduction. Educational level is a risk factor in teenage pregnancy. I would like to remind you that adolescent pregnancy is a subset of teenage fertility because adolescent age group is between ages of 15 and 19, while teenagers are from 13 to 19. So adolescent is actually a subset of teenage. So better utilization and distribution of resources will be achieved if people are well educated, and this improves on people's quality of life because that means they will seek for healthcare in the wrong places, they know the right places to turn to for advice. Then government planning will also ease with controlled fertility rates because then they can distribute resources more fairly. This study carried out is also significant to public health since by lowering fertility rates, population growth and its effects will also decline. Effects like diseases due to overcrowding, malnutrition, maternal, infant, and child mortality will reduce sufficiently. Lack of financial empowerment in mothers and low educational level will also reduce because an average teenage girl who gets pregnant is likely to drop out of school. Then the study also aims at filling a gap in knowledge on contraceptive uptake among adolescents and creates baseline data viable for further research. Cross-sectional study design was adopted to assess the uptake of contraception among adolescents aged 15 to 19 years. The sample for this was gotten from the 2013 Nigerian Demographic and Health Survey, and it was a stratified sample, and it was selected independently in three stages from the sampling frame. An all-inclusive criteria was used in which all adolescents within the said age of 15 to 19 years who gave consent and were willing to participate in the study were used. Analysis was done by using the Statistical Package for Social Sciences, that's the SPSS software version 20 program. Then qualitative data was analyzed in relation to the study variables. A chi-square test was used to measure the strength of associations between the various variables, where a p-value of equal to or less than 0.05 was statistically significant. The number of adolescents between the ages 15 to 19 years on contraceptive was established. Levels of awareness, utilization, and barriers to contraceptive utilization among them was also established. So the results and discussion. For the purpose of this presentation, I'm taking my results and discussion from the angle of what a private and public partnership can do, because as we all can see, this topic is definitely broad. So a lot of things were looked into. If you can have access to the full article, you will know everything that I did. But for restricting to the short minutes I have to present here, I'm actually doing a pictorial presentation on what we can see from what the public is doing, from what the private is doing, and where actually these adolescents are turning to get their contraceptive needs met. A lot of them still have unmet needs, just like I pointed out earlier. So when we look at injectable, of course, there are different forms of contraception. We have the traditional method and we have the modern method. Under the traditional method is this checking of the cervical mucus, using calendar dates and everything. But for the modern method, it actually involves hormonal manipulations. So we have the injectable. We have the injectable one, which is we can see from the pie chart that the public sector has a significant a role that they played in providing injectables to the adolescents. Then for the female sterilization, the public sector has a role, but for the two, we can see that there's a significant role played by the private sector. Then for pills, Public sector gave pills, but obviously from the pie chart you can see it's the private sector that is colored in red. So it's the private sector had more role in distributing pills to the general public, especially adolescents, when it comes to family planning and contraception. For IUCD, we have more of the public sector. For implants was given more by the public sector, but we can see that a large area can also be covered by the private sector. So keying into this private sector provision of contraception will definitely go a long way in stopping unwanted pregnancies, meeting the unmet needs from meeting the unmet needs of contraception. Okay, then for condom, the private sector definitely gave more condom than any other sector. We have the public sector, the other sources like Friends and Co, but the private sector was still telling us that the private sector is key and will definitely play a pivotal role if we want to put an end to the unmet needs and unwanted pregnancies in the adolescents. Presence of unmet needs of contraception definitely exists among adolescents. That has been established. There's a huge lack of knowledge among adolescents concerning contraception. Then the private sector plays and still has a great role to play in bridging the gap of unmet needs of contraception, and this role cannot be undermined if we want to achieve the desired results. My references are as displayed. Then for conclusion and recommendation, the first for conclusion and recommendation, unmet needs exist definitely among the adolescents. Enough has not been done to reduce this burden, especially in rural areas, among those of low socioeconomic status. Complications arise from this failure. We have death of a mother, that's maternal death. We have death of an infant. Complications are family planning programs to strive to provide microdevices to a range of it is not the government they must be
Penso che non fanno a provare adesso
so that the digital family planning will be used as adolescent friendly centers to be open for sale, centered on women. Training and retraining of all family planning workers is needed. Well,
what I did
we need to retrain family planning workers because they are the ones who provide for adolescents. And confidentiality of adolescents who seek to have family planning must not be breached. This transitional stage of the life of a child is very important, and if it is started with, a lot of things will definitely go wrong. Okay, so parents must give their full support to their words so that they can turn out successful and not have unwanted pregnancies, which might actually jeopardize and put an end to their lives. Parents are the first contact of this adolescent, and they need to pass the message of sex education across without being judgmental. Healthcare providers must pass the message of contraception across without being judgmental. Education is key to making informed choices, and every child needs to be educated. Socioeconomic discrepancies should become negligible because definitely it's only if we want to deceive ourselves that's when we'll say that we don't have socioeconomic discrepancies. There's a wide range of gap. There's a wide gap among educated and uneducated, among those that are rich and those that are not rich. This cuts across not just contraception, but all parts of public health. So we have to bridge this gap and reduce these discrepancies if we actually want to see significant improvement of contraception across the board. Because whether we like it or not, an adolescent gets pregnant, it affects everybody. Maternal mortality is on the increase. If the adolescents in the rural area are not well taken care of, they also contribute to the data, to the statistics we have on maternal mortality, no matter how well the other parts of the country are doing. So this is very important. So with this point of mine, I believe I have been able to pass across my message to some extent. Hope you were able to understand what I said So thank you very much for listening. Thank you very much for your time. Thank you for listening.